I would like to bring on other associates. They probably own their own business. We just are going, I want to be a collaboration hub in that wellness sector. So a one-stop shop for somebody who is going through all the things. I mean, when we talk about um, the weight loss drugs that are on the market, and we can hear in the news, oh, they get the Ozempic face. Well, if I'm working with their practitioner to then start doing laser toning why they first start this weight loss drug, they're not going to get that muscle loss. They're actually going to stay rejuvenated, but they're going to lose the weight that they need to lose to feel confident and feel healthy. And we're all going to work together. So that's what my future I see for my practice.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Miranda Malone, the founder of Essential Rejuvenation Medical Aesthetics and Ellie's Hope nonprofit. With 23 years in the medical field and 13 in aesthetics, she's a licensed esthetician, certified paramedical tattoo artist, an 8-time certified laser specialist recognized as Best Med Spa, Best Medical Esthetician 4 years running, and Best Laser Tattoo Removal Artist of the Year. Named Woman of the Year 2023 by Little Black Book Women in Business, Miranda is known for her no-fluff, results-driven approach to complex skin issues and scar revision. She bridges medical precision with compassionate restoration, helping clients and survivors alike heal, renew, and reclaim their confidence. So Miranda, welcome and glad to have you here.
Hello, nice to be here.
Yeah, so let's start off with this, Miranda. How did you first get interested in the medical field?
Honest to truthfully, when I was in high school, I really didn't have a plan. And I ran off to medical assisting school and happened to get on with a really awesome practice here in my area. And I worked there for 12 years and learned from some of the old school best doctors. And that's really where the journey began. And then years later, my mother got ill and I became her caregiver for the 12 years that she was ill. So it all just kind of all meshed together and blossomed from there.
Okay. And so what led to that transition into the aesthetics field? So from medical to then aesthetics, like what was the spark that kind of caused that transition?
So I honestly didn't even know aesthetics was a thing. When I worked at the doctor's office, I loved minor surgeries, poking and picking at things. And so originally I was going to go back and get my RN license. And as I was going through the schooling process, I figured out about aesthetics. And when I walked into that school that day, it just felt like home. It was the place I needed to go, the place I needed to be.
Okay. And so what was the journey that eventually led you to want to start your own practice? I mean, why start your own practice? Why not just work somewhere else?
So for the first years of getting out of aesthetic school, I knew immediately when I was in aesthetic school that I wanted to be a medical aesthetics. So whether that was lasers, working for a doctor, it really didn't have a significant plan in the beginning, but I knew that's where I wanted to go. And for the first, I would say 10, 12 years, no, not that long, 7 or 8 years, I did work for somebody else and I did help build their practice. Somewhere along the lines, it got more restrictive for me to help clients. And I was building someone else's dream and I didn't want to do that anymore. And in 2021, after my mom had passed away, I knew it was my time to leap and to do what was going to make me proud.
Okay. Well, it sounds like it's been quite a journey to get you to where you are now with your own
Yeah,
practice.
yeah.
Okay. So now with your own practice, I want to dive into some of the treatments that you provide. So lasers, I believe, is something that you're very you go very deep into. Could you talk a little bit more? Because I know there's lots and lots of lasers out there. What
Mhm.
are lasers for people who have never done any type of aesthetic treatment or procedure before?
So most of the time when we're talking lasers, and the first thing that probably comes to people's minds is being very scared of them. Oh, my face looks like it was burnt off, or my face is peeling off. And I think obviously mainstream media, movies, TV, that's where people's mind goes to start. And
Mm,
then the next category is probably going to be the people that have a lot of sun damage or pigmentation issues. And
mm,
so they're the ones that probably know a little bit more about lasers. And so you'll hear the term IPL a lot, or BBL. And that's usually what starts to get people's minds going about what lasers are. But it is such a bigger spectrum than that, and the things that it can do.
okay. And for lasers, is it something that's really specific for the face, or lasers can also be used on the body as well?
No, you can use it anywhere on the body. Well, I say anywhere on the body, but typically we're talking, you know, not so much like the bottom of your feet or
Mm,
something like that. I mean, I
mhm,
guess you could, but most of the time it's going to be the body, the legs, the arms, the face, um, and you're able to utilize it for a multitude of different reasons
mm.
and have very minimal downtime.
Okay, so that seems like that's the biggest benefit of it is the low downtime, low to no downtime.
Yes. Now, I'm not saying all of them. There are definitely lasers. One of the other terms that a lot of people will hear frequently is the CO2 laser or fractional lasers,
Hmm.
which there is a definite downtime with those. But they're typically fixing a very, very specific problem. And it's well needed.
Okay, and I did dive a little bit deeper into what specifically can the lasers do because I think people have heard of different types of lasers, and you kind of alluded to this already. Like it can do a lot of different things. They can do things for the face. Also, I'm thinking like laser hair removal, so even for like hair
Mhm.
removal. So like trying to make your face glow versus removing hair is two very, very different things. So can you
Right.
just talk about like from a high level, like what are the kind of the main things people come to you for, or that lasers can specifically solve? Like we talked about hair removal, but like on the face, what can it do specifically?
Correct. So my two main clientele with the type of lasers that I do here, number one is going to be skin rejuvenation. I do a type of treatment which is called carbon laser peel. And so we're going to use a carbon cream, which I'm going to put on the face. And basically, that is going to help with facial toning, facial glow. It makes your pores seem smaller, even though we can't shrink them, but it just really cleans everything and gives that tone and glow. Um, and then also pigment removal. Those are my two biggest things on the facial side of things. I have a lot of people, I live close to a river here. I have a lot of boaters that come in after the summer, and we clean up the damage that happened over the summer because they are outside a lot.
Mhm.
And then I also do a lot of scar revision on the face. So if somebody has gone through Mohs surgery for skin cancer, I'm able to help minimize the appearance of the scars on their face, which sometimes makes people not want to go out in public or be seen. And so I help give them their dignity back. And that is also on the same side, I do tattoo removal. So obviously, there are a lot of people over the years who maybe have gotten tattoos in college or just for fun, and
Mhm.
they're not looking to have them there no more. So I do see a lot of those, but we are seeing the upswing in cosmetic tattoo removal. So the eyebrows, the eyeliner, the lip liner, things like that. They're wanting to change the color. They want to make them smaller. And so it requires a bit of removal before the next artist can give them the new wave thing that they're wanting.
Got it. Okay. I want to take a step back to the sun damage part. I want to understand, like, what do you do specifically for the sun damage? Is it just that the skin is not healthy? Is it just like really tanned or red, or like kind of like how does someone know that they have sun damage? And I guess what does the laser do to fix that?
So, sun damage can be a little tricky because I will have some people that come in and they truly think that they have sun damage. And honestly, it's actually called what is called melasma.
Mm,
And it can look like it's sun damage because the face is still brown
mm,
or darker in color versus your normal skin tone. And so I have to decipher the difference between, is this melasma? Is this sun damage? Or is it even maybe like a post inflammatory pigmentation issue where maybe they had a pimple or a cyst and the redness then discolored their skin. So I have to decipher between all those things, because if it is melasma, the same light that we're treating sun damage or laser, we would not want to treat melasma with that because we don't want the melasma to feel that heat again, or it's just going to get darker and darker and darker.
mm.
So typically, like IPL, some BBLs, they have made the BBLs a little safer for melasma clients.
Mhm.
But I don't use those in here. I use a photoacoustic type of laser so that it is safe for both spectrums.
Okay. Okay. So, and actually, you were mentioning something, the BBL. I actually want to get some clarity on this because people in the aesthetics industry, when you hear BBL, can also think of Brazilian butt lift. So
100%.
I'm assuming that this is not that.
No, no, it's a different light spectrum. So a lot of the times it was IPL, 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 and just lasers keep getting more and more advanced, and they're adding more and more modalities on, and so the BBL became another form of laser, which is a bit safer. Um, Not saying that the IPL isn't safe, but if you are beyond a Fitzpatrick of 3, you shouldn't be using those type of lasers. It will burn your skin. It will pull your pigment out of your skin.
Okay. Now, Miranda, you were talking also about scar revision.
Mhm.
So, and you're saying that it helps to make it not so easy to see or kind of try to remove the scar. Can you talk
Mhm.
a little bit more about what specifically is happening? Like, is the laser just trying to blend the scar color with the rest of the face, or is it actually like breaking up the, I don't know if scar tissue is the right word, but like, is it breaking up the scar tissue that the scar actually itself is disappearing?
Correct. So, scars, it's basically like underneath the skin is the death of your cells.
Mm,
So your collagen, your elastin, those fibroblasts, nothing's moving. That's why the scar stays there and it doesn't
mm,
really ever change. It's like the death of a cell.
mm,
And so basically, and I don't always just use the laser to do scar revision. Sometimes I might use LED light therapy, which is a little bit softer, a little bit safer. I might also use a little bit of microneedling slash microchanneling, and the laser. So it really depends on the person. But basically, when any of those modalities are hitting the skin, it's basically reawakening your cells underneath the skin to then get that collagen and elastin to start working again. So then it's rebuilding the cells underneath there along with the outward appearance. It's less noticeable. So it's toning the outside of the skin. So we're seeing less of the visible scar. but it's doing more of the repair internally to then work its way up to the top of the surface.
Got it. Okay. Understood now. And when you also mentioned tattoo removal,
Mhm,
but you mentioned something specific. I don't remember, like aesthetic tattoo removal or something along those lines.
mhm,
Could you have a little bit deeper into that one? Because that when you're talking about like eyebrows or things like that, I wasn't quite sure
mhm.
I understood like if they already had a tattoo of the eyebrow and you just kind of clean it up, or can you just explain a little bit more on that one?
Yeah. So obviously people can now basically do anything that they want to change things. And so sometimes people want bigger eyebrows, smaller eyebrows, darker eyebrows, whichever way. But as time goes on, your eyebrows, your lip liner, those things, they fade, just like a regular tattoo would.
Mm-hmm.
But the thing is the type of ink that is used for permanent makeup is not the same type of ink that is used for actual tattoos. So getting rid of the cosmetic ink, we're actually fully getting rid of that ink. So when somebody comes in to get their like eyebrows removed, they leave here and they don't really have any eyebrows on because it's just the little amount of hair that was left from when they started. And so the goal is that that color is gone. So when they go back to the artist has a fresh, clean slate to then build them new eyebrows or lip liner or whatever the case may be.
Okay. Now, I know we talked about a couple different things as far as like the tattoo removal, the scar revision, the sun damage, and I'm sure there's a lot more skin rejuvenation also. Typically, what's the frequency? Like, how many sessions does someone typically need to have with any of these given treatments?
So if we're talking skin rejuvenation, to see what you're going to look in the mirror, because me as the esthetician, you can come in after your first time. I'm going to notice some significant changes, but at the end of the day, it's what the client wants to see. They want to look in the mirror and see. And I would say with skin rejuvenation for anti-aging, we're looking anywhere between like 3 to 6 treatments to really notice that huge difference.
Hmm.
If we're talking tattoo removal, that really all depends. Is it the cosmetic ink? Is it traditional ink? Was the artist heavy handed? Were they not? How many years have you had it? There's a multitude of different reasons, but anywhere between 5 to probably 15 treatments for full removal.
Hmm. Okay. And what about the recovery time in between? Like, can they just get it blasted back to back to back, or how much time do they need in between treatments?
So each thing's a little different. Typically, for like skin rejuvenation, pigment removal, you're looking at 4 to 6 weeks. There are some small cases with some of my clients. If I know and I've watched their skin well, I will do an every 2 week cycle, but that is when we're being pretty aggressive. And I have to know that there's a good bounce back in their skin.
Hmm.
With tattoo removal, you need anywhere from 6 to 8 weeks because our body has to process the ink out and it does take time. So it's not that it's a super supposed to be a super long standing thing. Um, but it does usually, I would tell people to get to what you absolutely want to see on any spectrums with the laser, consider yourself being involved for about 6 months to a year of
Hmm.
basically monthly to every month and a half treatments.
Okay, good to know then. Now, with all these different types of lasers and conditions and treatments, I'm sure you get hear a lot of misconceptions or a lot of myths about this type of treatment. What are some of the most common misconceptions you hear the most?
Um, so the new one on the streets is that if somebody has filler and it's too much, that they are now being told that they can use the fractional laser to kind of melt it down and get out of their face. And no, that they no, they don't work together like that. They don't do that. So that is a myth. Another myth is that doing skin rejuvenation treatments, and maybe doing Botox and fillers that the two work synergetically together. They have nothing to do with each other. One is rejuvenating, the top layers of your skin. The injectables are either filling the skin and or stopping the skin from moving. So the two they do nothing together. I mean, there are so many myths and misconceptions. I could go on all day.
Okay, so then let's say someone is looking to get some type of treatment done. They're looking for a provider. They don't know who to go, who to choose, who to go to. They don't know anyone in the industry. What advice would you give this person as they're doing their search to find someone that does know all these differences, knows the misconceptions, and knows how to basically get them a good result in the end?
So one of the biggest things is, okay, so we're going to go to Google first, and you're going to see a list of people in your industry. I would also say, go into their website, look at the type of treatments that they have first, and maybe read the reviews on the person, because the type of esthetician that I am, just like you said it, no fluff results. I'm not fluffy by any stretch of the imagination. You're not going to get massaged with me. You're not going to get seaweed thrown on you and all pampered. I get down to business and I do correction. So there's no real fluffiness with me. So as a client, you need to know, do you really want that more spa-like situation? You want to be pampered and unwind, or you want to get down to business and you're looking to correct things? That's the two biggest things you need to figure out as a consumer. And then the next is going to the website, reading what treatments they have, reading a few reviews. But I would call in and talk to the practitioner or the esthetician and say, hey, what's your style? How do because it would be such a disadvantage to go into a clinic thinking, oh my gosh, I'm going to unwind. I'm going to hear soft music and low lights, and I've got the brightest surgery light on your face, and I probably have rock and roll on just because that's the vibe. So that's the most important thing, is figuring out what your vibe is and finding that type of clinician.
Mm, very well said. Very well said. Now, Miranda, what role do you believe creativity plays in how you approach your client care and how you perform these treatments?
So I am not a one box fits all type of person. Yes, you might go to my website and it list this for this price, but when somebody comes in, I build their treatment plan off of, one, what they're looking for, but two, what I'm seeing with their skin. I
Mm,
like to be realistic with people. I mean, I can make you look younger, but I'm certainly not going to take you from 50 to 25. Like,
mm,
let's just, we got to be honest about that.
mm,
But I can certainly make you feel good in the skin that you're in, maybe less makeup and less worry. And I also, as I may consult the first time you come in, but I'm also going to consult every time you come in. I do before and after pictures, every single treatment, because if something's not jiving or something's not changing, then I'm having those conversations. And some people might think it's crazy, but I can tell if somebody's skin, like if their body is inflamed, for instance, that's going to make their last treatment look like they didn't receive a really good result. And so I have those really deep conversations so that I can give the best result to my client. And that way I'm not just getting their money and whoop, we're hoping for the best. I don't
right.
want to do that ever.
Okay. Now, Miranda, I'm sure that throughout your experience, you've had some maybe challenging cases or at least memorable cases that come to mind. Is there maybe one story that you can share of just one of those cases and how you were able to get them a great result in the end?
Yeah, I actually, there was, and actually it was more just recently. I have many of these, but since this is relatively newer, I have a massage therapist that rents out room here, and she had a client she sees regularly. a year ago, she was on vacation and she fell off the porch onto concrete and busted her head wide open. Um, though me and you probably wouldn't have looked and saw such a big scar or something noticeable, she did. Every time she looked at herself, it held her back. She had never really done any type of aesthetic thing or even went and looked for it, but she felt comfortable enough to consult with me and start a treatment plan because her massage therapist knew me well. And I am happy to say that you can barely see the scar on her forehead. She now puts her hair behind her ears now. Everything is front and center, and she is the happiest that she could be. Those are the stories I love. Those are the stories that mean the most to me because I'm giving somebody something back they thought they could never get back to.
You're giving them their confidence back.
100%.
Yeah. Now, Miranda, you also have a nonprofit. Can you tell me a
Mhm.
little bit about your nonprofit?
Yeah. So my nonprofit is called Ellie's Hope, which is named after my mother. My mom died in 2020, and I was her caregiver for 12 years. I knew that I wanted to start a nonprofit in her name, but I didn't quite know where I wanted to go with it. And so it just kind of sat there for a little bit.
Mm-hmm.
Um, and then one day it just dawned on me. I do all this scar rejuvenation and tattoo removal, and I'm very big in philanthropy myself. And so, what my nonprofit does is those who have suffered medical traumas, accident traumas, veterans, those who are rescued out of trafficking, domestic violence, or gang violence. I do their branding removal or their scar revision at no charge. So, for instance, if somebody went through breast cancer, sometimes they lose their nipples. And so I will tattoo nipples back on for them at no charge. If we're talking about veterans, sometimes they have a little bit of PTSD if they got tattoos overseas during a time of war, and maybe they don't want to look at that anymore. They don't want to remember that. So we're going to help them remove that, and then they don't have to think twice about it anymore.
Okay, wonderful. Sounds like a wonderful nonprofit then.
It's awesome. It's very rewarding.
Okay. Now, Miranda, where do you think the future of aesthetics is going?
Definitely, I really do believe more and more that the medical world and the aesthetics world, it's going to continue to really bridge together. We're learning more as we go that obviously anything that goes on with the body comes out through the skin.
Mm,
So we're not just getting acne because, well, we just happen to be a person that gets acne. There's probably something going on internally to cause that. So I really do feel like you're going to start seeing more MDs, nurse practitioners, functional medicine, and then clinics like mine. We're all going to start collaborating together to create the best outcomes for our clients all together.
okay. Yeah, I'm
That's
starting to
really
see.
where I see things going.
Yeah, I see more and more. Also, the wellness side, like people are going to try and fix the inside first, and that'll be reflected on the outside.
Correct.
So, okay. So then, with that in mind, also, what for your practice, essential rejuvenation? What's your vision for your practice?
My vision is I would like to bring on other associates. They probably own their own business. We just are going, I want to be a collaboration hub in that wellness sector. So a one-stop shop for somebody who is going through all the things. I mean, when we talk about um, the weight loss drugs that are on the market, and we can hear in the news, oh, they get the Ozempic face. Well, if I'm working with their practitioner to then start doing laser toning why they first start this weight loss drug, they're not going to get that muscle loss. They're actually going to stay rejuvenated, but they're going to lose the weight that they need to lose to feel confident and feel healthy. And we're all going to work together. So that's what my future I see for my practice and really niching down. There's still some things that I do on quote unquote the fluffy aesthetic side that I would love to hand off to maybe a newer esthetician that is looking to grow a book of clients and kind of figure out what type of practitioner they are. And that's where I really look to see to go with my practice and just help as many people as I can. That's really true to my heart.
Wonderful. Well, Miranda, I have one last question for you, but before I ask it, I do want to point people to your website at ESSREJMED2023.com.
Yes, the longest name in history.
Okay, well, my last question for you then is, what does beauty mean to you?
Beauty to me means waking up and feeling good in the skin you're in. That's what
Well
it means
said.
to me.
Well
Yeah.
said. Well, there you go. Miranda sharing your expertise. So, Miranda, where can people contact you in your practice?
They can go to the website that you just listed, or they can feel free to call me at 636-439-9380. I am in the St. Louis, Missouri area. So I'm not sure where all this podcast goes out to, but I am also the type of person, if you feel you're not getting an answer from someone in your local area, I am always open to an email or a phone call to help guide somebody to find somebody in their area.
Awesome. Well, Miranda, this is great. Thank you for coming on, and thanks for sharing your message.
Thank you so much.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.